Dr. Beto here, physical therapist, and today I want to talk about activity tolerance, especially for individuals that have COPD, asthma, bronchitis, emphysema, any respiratory issue that individuals are going to be able to maybe have to be on oxygen, to be able to walk, to be able to exercise, and what we can really do for you or for a loved one that's having this to try to increase their capacity. So really we're focusing on doing an activity, but doing it more for time, because you're going to get fatigued a lot sooner. As we're breathing in, as we're breathing out, and we're trying to replenish our oxygen, trying to get that oxygen back on the red blood cells, get the red blood cell and the oxygen to go to our tissue in our body, it starts to have a kind of a net deficit effect where we're not able to drop off enough oxygen to all the tissue all the way down to the turnaround point. And so in these types of patients, what we're seeing there to be a decrease in oxygen versus a decrease in fatigue, right? So the fatigue's coming on, but it's coming on not because the muscle's necessarily weak, but because they don't have enough oxygen in their body to continue to be able to perform the function they're trying to perform. So what we can do is we can really focus on time. And that's what I want you guys to focus on. We're still going to go through some of the normal exercises. Most people are going to be having a walker, a cane, a rollator walker, sometimes in a wheelchair. We can do exercises in sitting, but the rule of thumb is to focus on a continuous activity for a certain length of time and trying to build upon that length of time. So in standing, we can really do most activities, but we want to focus on how long are we able to go before our oxygen saturation starts to fall down. So what we really need is that we need a pulse ox, and we want to be able to wear this on ourselves if you guys are performing this with me, or on your loved ones, so you guys can monitor to see what their oxygen saturation is. So for a healthy individual, we're gonna get tired before our oxygen actually starts to go down. But for someone that has a respiratory issue, what we're gonna see that oxygen saturation starts to dip. And when it starts to get to 92 and below, we really want to sit down and we want to rest. There's going to be a slightly delayed reaction with this, because as you breathe in and take a deep breath, right, that oxygen gets in there, it's getting into our bloodstream, and it's getting transported down, but it's going to take a few additional seconds for there to be an actual change. And so when we start to see that dip, we really want to rest when it starts to hit 92. You really want to be more concerned if it's around 88, because as that curve drops off, it's gonna start dropping off faster and faster, and that's when people pass out. So now that we're wearing our oxygen saturation, our pulse oximeter, we're gonna get started. So again, time component. Let's start the timer, and let's just start with some nice hip flexion, just marching in place. We want to perform these movements in front of something we can sit down on, if that's a bed, if that's a chair, if it's a couch. We're not really going for a certain repetition, we're going more for time. Now, if we do start to get tired and fatigued in our hip flexors before we run out of oxygen, before our oxygen saturation is dipping, we can switch to a different activity. But again, we want to focus on time. So we're at 30 seconds, might be a good time to switch to something else. We can kick out to the side. Trying to find a nice paced breathing pattern. A good one that's hard to do when you're talking, but a good one for you guys to do is breathe in through your nose and out through your mouth. Let's keep it going. We're getting close to 60 seconds. Make sure you guys are checking your oxygen saturation to see if it's still good. We're going to keep going. If it's not good, go ahead and sit down. Pause the video, take a break, take some deep breaths. We're going to go up on our toes. Again, we're trying to do each movement for about 30 seconds until we get to the point of fatigue where our oxygen saturation starts to dip. But please, at that point, make sure you guys are resting. You guys are sitting down until that oxygen saturation comes back up above 92% at least. But back up to normal range. Some people's normal range is going to be 94, 95, 96, 97. So depending upon what that is for you, rest until you get back up into that normal range. All right, we can do quarter squats. Again, we're trying to just keep performing an activity for as long as we can until we have to sit down and rest. So let's say at this point, okay, my oxygen saturation is declining. Let's sit down, let's rest. I don't have a chair behind me, but let's say that I do. We want to focus on sitting down, deep breathing. If you guys are wearing oxygen, if you guys are wearing a mask or a nasal cannula, make sure you guys are breathing in through the nose and out through the mouth. Make sure you guys are taking nice deep breaths to really get that oxygen down deep. Make sure you guys are exhaling to be able to get everything else out. Now again, make sure you guys are resting until your oxygen saturation comes back up to within normal limits for you, whatever that may be. If you guys don't know what that is, make sure you consult your primary care physician. But then continue doing this. And what we're going for is we're going to increase the time overall. Right? So if this time you guys made it only 45 seconds, shoot for that 45-second mark. The next time, I try to increase it by 5 seconds. And you guys can keep doing that day by day until you guys are stretching that capacity. You guys are increasing your activity tolerance. You guys are increasing your body's ability to be able to take in oxygen, process it, take it to the tissue source that it needs to be, and be able to operate and function. So that's activity tolerance. Those are exercises geared more towards respiratory issues. Please, guys, if you made it this far, like the video, please subscribe for some more videos, and have a good rest of your day.